Kovo from Fitting Fitness In. I'm a personal trainer and nutrition specialist, and welcome to Get Healthy with Holly. Today I have Dr. Todd Whittemore from Stow Family Chiropractic with me. Welcome, Todd.
Hello, thanks for having me.
Thank you for joining me. I wanted to let people know about chiropractic care and how it can really benefit your health. So let's talk a little bit about chiropractic care and maybe how you got into it. How did you become a chiropractor? Why?
Well, I'll try to keep it short.
Okay.
No, the biggest thing is I got injured multiple times. I played sports growing up, and multiple times I tried to get, fixed or get healthy, and I went to multiple specialists, and no one truly could help me. And when I went to a chiropractor, he fixed me like it wasn't that big of a deal. And I was like, that really kind of opened my eyes that, you can help people without necessarily, medication or surgery. And that's what got me really excited, that allowing the body to kind of, get the nervous system working better and have it heal itself, which is pretty cool.
Wow. And so, the way I got introduced to chiropractic care is I had fallen skiing and
Okay.
I messed up my hip, but I didn't really realize it until the spring when I started trying to run. And I was, well, I don't know, 27 when this happened.
Yeah.
And I started running and my hips were killing me. And so I was mentioning it to somebody at work and they said, you should go to the chiropractor. So I went to the chiropractor. And it wasn't you at that time. It was
Yeah.
Dr. Gerard in Hudson. And he adjusted me and immediately I felt better. I was like, whoa. So every once in a while I would go back. And then I realized, wow, it just makes a big difference.
It sure does. It's made a big difference in my life. And I was like, I want to be able to do that. And that's why after multiple injuries, I said I changed my careers. I was an engineer before I was a chiropractor. So I was like, okay, I want to go back to school. The last injury was I was playing adult hockey and I got cross-checked across the ribs and my rib went out of place, could barely breathe. And nobody could really help me. And then I went to a chiropractor and he adjusts my back and my ribs and I could breathe again and I felt better. And I said, okay, I'm going back to school.
This is it. This is it.
Yeah.
So what are some of the other common treatments that people come to you for?
Well, like you would imagine, I mean, the most people come in for like neck pain, lower back pain, maybe shoulder pain. That's mostly what I see. But what people don't realize is that, your spinal cord is an extension of your brain. That's all your nervous system. And your nervous system controls and function everything in your body, including your heart, your lungs, your digestion. So if we get that working better, not just do we get neck pain or back pain working better, the whole body functions better.
That's right. Since I've been going, I go regularly now for maintenance with you. I hardly ever get sick. I mean, rarely do I get sick. And if I have a little cold and I have the sniffles and I go and you realign and adjust my neck, all of a sudden everything just drains down.
Yeah. Well, because the body starts working better, starts
Right.
functioning better. Something's out of place and then it irritates the nerve. And wherever that nerve goes to, it's going to cause a problem. And then it starts to drain because everything's back in alignment and your body's closer to homeostasis. And then you start feeling better as well.
Yeah.
So.
I love that poster you have on the wall where it shows all the different vertebrae and the organs and part of the body that it affects.
Yeah.
So when you're subluxated in a certain area, you're going to feel it somewhere else.
Absolutely. I love having that up there because a lot of people come to me, oh, I didn't realize that this is going through your back and it goes to everything. And so that's why I like to have that poster on the wall so people get that it's more than just back pain and neck pain. We also treat things like headaches and migraines and, carpal tunnel, plantar fasciitis. These are some things that when we get the body aligned, the body heals itself, if it's just given a chance.
That's right. And I remember one time I was subluxated right here and it affected my jaw. It was crazy.
Yeah, yeah, no, it happens, and then it's, check you, make sure that you need an adjustment, and then make an adjustment, and then it really helps. I
Right.
love seeing that. That's what gets me up in the morning. I get so excited to see the change in people, over time.
Right. So, and what makes Stowe Family Chiropractic different than other chiropractors?
Okay, well, I would say two major things. I would say state-of-the-art technology. I love technology because it really helps. And then the other thing is thoroughness. And let me explain. So, like the technology in the diagnosis, we use surface EMG, which measures out how the nervous system's working. We do a digital X-ray. We also do a digital 3D foot scan, because what we found is your feet are the foundation of the rest of your body. And if we don't address that, we're kind of like a cat chasing our tail. So we like to, get you balanced all the way from the feet all the way up to your neck. And then in treatment, we have a couple of great things. That one is therapeutic laser, which I know you
Yeah.
know about, because you're the one that helped me kind of push me to get it.
I know I had to go to a different chiropractor to use that laser. And so let me just pop my little story in there.
Yeah,
So, I've had problem with my left knee with arthritis and a torn cartilage. And I was able to stave off surgery for over 3 years by using that laser.
that's
Because
pretty
just using
cool.
those laser treatments that reduces the inflammation, cause everything to be better, I was able to push it off. And so I was going to a different chiropractor and I kept saying to Dr. Todd, I'm like, you need to get a laser here. You
I'm
really
sick
need
of
to get a laser.
traveling.
That's right. Well, and there's so many athletes that could use it. Not just, me as a personal trainer, but the high school athletes, knees are
Yeah.
really.
Well, and thank you for that.
You're
So I
welcome.
got one and it works so well. I have three now.
3.
Yeah, you
Wow.
probably didn't know that.
I didn't know that.
Because it works so well. It's amazing to me. I knew how good it was, but then once I really put it into practice and started helping people, I'm even amazed, like how great it works. It decreases inflammation,
Mhm.
decreases swelling, decreases pain, and allows the body to heal quicker. The body absorbs the light all the way down to the cellular level, the mitochondria. It creates ATP, which is the powerhouse of the cell and the body, and then it allows your body to heal quicker. And that's how it works. I mean, there's science behind it. It's
Oh
really
yeah.
good.
Well, and I stand by it, and I talk about it to my clients as well. So, and I send people your way as well.
Well, of course, and we appreciate that. Thank you so much.
So, one other thing I wanted to mention too, because you talked about scanning the feet.
Yeah,
I remember when, I was complaining that my hips were bothering me, and we scanned my feet, and you gave me custom orthotics.
yeah.
And as soon as I put those on, I stood up. I was like, oh my gosh, it was just enough to tilt me a certain way. And I was like, wow, immediately I felt the difference.
Yeah, and that's so important. And I'll be completely honest. When I was first in practice, I was more in the mindset of like, I'm going to fix your spine with my hands and the adjustment, and then we're going to support you with orthotics down the road. And I learned more. That's why they call it a practice, because the
Right.
more I've learned, the more I realize, just like your situation, the quicker we get the orthotics right from the beginning, it supports you every time you take a step.
Right.
And then you hold your adjustments better, you get better quicker. So I've changed the way I work with the orthotics and people, and I scan everybody from day one, and that way, and I've gotten way better results.
Oh, wow.
So,
Well, I
so
know
yeah,
I have 2 pairs and I just switch them from one shoe to the other. And I have the athletic ones that,
yeah.
can handle a lot of impact. Um,
Oh,
because
they're
I'm active.
wonderful.
I'm very active. So let's talk about what people can expect when they first come in to you as a first visit.
Okay. So first visit, like I was talking about, using all the technology to really evaluate you and your spine and see what's going on, so that we know that it's a fit like this, you know, And if it's not, I will let you know that. But there's a lot of things we can do to really check out to see how we better can help you. That's all about day one, is really evaluation. And
Mhm.
then day two is like a report of findings. So I explain all the things that, we found on the first day, like, the foot scan we go over the digital x-rays, we go over the surface EMG, and then like what your goals are for coming in. Like, it might be that you want to get, on the ground to, play with your grandchildren, or it might
Exactly.
be that you want to play sports at the next level, or you just, simple, just want to get out of pain. There's a lot of different reasons why people are coming in. So that's what the day two, or the report of findings is about, to kind of, and then coming up with a plan that we fit into your schedule and into your budget, and we go from there.
Right. I know that in the beginning, if something's off, something is subluxated, that people come more like 3 times a week for several weeks, and then you wean it down to 2 times a week, then one
Yep.
time a week, and then you can eventually get on maintenance, which is what I do. My whole family, I go every 3 weeks,
Yep.
um, and just to stay healthy. So let's talk about the immune system and our back, especially now with the pandemic. How um, staying with everything aligned nicely is going to help you with your immunity.
Absolutely. The more your body is in balance and doesn't have abnormal loading, and the more it's in homeostasis, which is balance inside, in the body, and more you're aligned, everything works better, including your nervous system, which is the main system that controls and regulates everything, which, guess what that controls, is your immune system.
Hmm.
And I talk to people not just about getting adjusted, but right now, especially since the pandemic started, I call it a full court press, like from basketball, like,
Yeah.
but you want to be doing everything in your power to make sure your immune system is strong as possible. I know everybody's talking about, the vaccine and, wearing masks and everything. And I'm like, I think the number one important thing is making sure your immune system's strong. So getting good sleep, drinking water, getting your spine aligned, so that it can handle more stress, which, a virus is definitely stress on your system. So maybe it's not going to prevent you from getting it, but, once you get it, maybe your immune system can help fight it off.
Right. And also the proper nutrients and
Oh,
eating
well,
right, all that good stuff.
exactly. The eating right too, right now, vitamins, vitamin C, vitamin D,
Right.
all these things really help. And, not eating, all the comfort food that we have, the COVID-19, right?
I know. I'm helping people work off that COVID-19 now, or the COVID-15, we're calling it pretty
Oh,
much.
COVID-15. Oh, okay.
Well, it's about 15 pounds that a lot of people have gained in the past year over the
Yeah.
pandemic. It's stressful eating, it's inactivity. Um, Not my clients, of course, because they've kept going. I've been just working with them on Zoom all through the
Which
pandemic.
good
But
for you,
yeah.
because that helps
Um,
the immune system too, exercise, obviously.
right. Well, my
Um,
motto is fitness is the fountain of youth.
It is.
So I've been to several different chiropractors. I mean, I started in Hudson with Dr. Gerard, and my kids went to Dr. Gerard. Let me tell this story.
Yeah.
Um, my daughter Marissa would get ear infections. And oh my gosh, nobody got any sleep because I was sitting up in the rocker with her all the time because she needed to be sitting up. And so somebody said, I read this article actually, it said chiropractic care for kids for ear infections because the doctor wanted to put tubes in her ears. And I said, well, let's try this first. So we went there and he started adjusting her every week. And all of a sudden, her ear infection stopped. So we went for a whole year. And I said, all right, let's stop and see if she's grown out of it. Week 3, she got an ear infection. So we kept going another year. And then, she turned 3. And I'm like, let's see if she grew out of it. 4 weeks later, she had an ear infection. I was like, all right, forget this. And then I had my second daughter, and within 6 months, I had her adjusted. she maintained, she kept going for adjustments when we did. She's never had an ear infection.
Wow.
And we moved over to you when the kids started getting active and the schedules just didn't work with Dr. Gerard, and you came into Stow. So it was really nice to be able to move there. But that's something that people don't even realize, that you can work with kids. And now my kids come regularly. I mean, when they were in high school and that backpack was full of books, and they were like, oh, my back hurts, I need to go see Dr. Todd. And I'm like, all right, let's schedule it.
Yeah, it makes such a difference. And the research shows that too, and sometimes medication is the answer and it really does a good job. But sometimes there's a physical problem in the upper part of the neck, and it's constricting the eustachian tubes, and then everything gets clogged up and it doesn't drain naturally.
Right.
So when we get things moving in there, it allows those ears to drain. And there's even an adjustment that we can do on the ear itself.
Oh, really?
Yeah. So, but I've seen many kids for ear infections that, after we start adjusting them, they just go away. It's wonderful.
Yeah. Oh, it was just amazing. I mean, like, I'm not stopping now. After 3 years old, and she got another one, I'm like, that's it. She's just going to go on maintenance. Every month we go, and, then Jessica started going, and we don't have any problems.
Well, exactly. It not only maintains what maybe we already corrected, but it prevents things from happening.
Right.
And as a mother, it's great when the kids don't get sick.
Oh, and when they sleep through the night.
Yeah.
Oh my gosh. Now, one of the things I like in your office, you have a lot of fun gadgets. You have that wobble chair that everybody uses. You have the laser. Do you have the laser near you? Pull it over so people can see. It's not like, some funky thing. He just puts those two prong, well, no prongs, those two things near where you need it, like around my knee, and it shoots it on there for 5 minutes.
Yeah,
That's all it needs is 5 minutes.
Yeah, it has 2 arms, and each head has 2 lasers each. So there's 4 lasers going on you for 5 minutes. What they found is even 1 photon can make a difference. This is putting out billions of photons per second. So, and this company is the #1 laser company in the country.
Mm-hmm.
They're phenomenal.
I like the phenomenon better.
Yeah, easy for me to say, but it's so great because it just it really works, and even better than I thought. So it's wonderful, and thank you for pushing me to get it again.
Oh my gosh, it was like, you got to get a laser. I hate going to another chiropractor to do laser and then come here. The other thing is there's several settings on that. So one is for inflammation. What are the other ones?
Oh gosh, I have a whole book of different frequencies. So many different issues, but there's, one for inflammation, there's one specifically for, pain. There's one for left migraine, right migraine. That's how specific that it gets. Ligament, joint, lower back pain, plantar fasciitis, carpal tunnel. All of these people, definitely above my pay grade, figured out all these different frequencies to work so that the body absorbs it and it helps that area the most. So it's pretty cool.
The reason I knew about the laser is one of my clients was going to the other chiropractor, and she uses the laser for allergies.
Yeah. Well, because the allergies are really hypersensitivities. Your body's having a reaction to that allergen. Mm-hmm. So, and a lot of times it causes inflammation. So even just that, if there's one thing that I think the #1 thing it does is it brings down inflammation, and if the inflammation comes down, then her symptoms for the allergen is not as bad probably.
Right. Well, that's true. And so she got me hooked on it. She was like, you should do that for your knee. And so that's when I started that, and the ball got rolling. So one of the other things I like in your office, which I don't get to use as often, is that rolling table. Oh. I think it's so cool. You get on there and it rolls and it massages you and basically gets you ready for an adjustment, right?
Correct. Yeah. I mean, that's the thing. Over the years, every year we ask the question, okay, how can we help people at the next level? What else can we bring on that will support what we do here at Stow Family Chiropractic? And that roller table is just wonderful because it relaxes the spine. It, rocks the spine to the point where it creates imbibition, which means the water goes back in the disc. So it
Oh.
really kind of sets you up for a good adjustment so that after the adjustment, it holds it better. And I know you never have the time to do it.
I like it when I go on it, but I know that it's especially effective for people that are sitting on the job or sitting in front of a computer all day.
Yeah. And especially I think where it works really good is that mid back, like when we're hunched
Yeah.
over like the computer, it works that mid back really well. So it's easier to kind of sit up and have a better posture.
Yeah. Well, I'll be using that next week when I come in.
Yeah. Yeah. And it's part of your care. We just, that's great. I mean, yeah, you should be doing it.
Now, one of the things that you talked about in the office was decompression. What are the benefits of that?
Yeah, so that's something that we just, we brought on last year. We've been helping many people with it already. And it's really for the person to prevent lower back surgery. So, like a disc bulge or a disc herniation, what it does is kind of the vertebra, it pulls them apart. It's like a traction and
Hmm.
it opens up that disc so that the disc can go back in. We do it in combination with the laser. That's why I had to get another laser so that we can put the laser on at the same time we're pulling the vertebra apart to suck that disc back in and take it off the pressure off the nervous system.
Well, we may have to do that next time I come in. But
Oh,
because I had
it's
physical therapy
wonderful.
for a bulging disc, and I had to do all these different kind of exercises, which is fine, but
Yeah.
something for us to
Oh,
look.
absolutely. We can talk about that. I know that's the cool thing. We have a lot of different ways that we can help people. I mean, my purpose is to help every single person that comes in here. And if I can't, I'll let people know. But I really try to bring on new things every year so that we can, help more people. That's what it's about for me.
Right. And I know people get scared off when they have to do x-rays, but how can you see what your spine looks like without the x-ray? I mean, you need to know something that your starting point.
I agree. I mean, a picture is worth 1,000 words, and I look at x-rays every single day, and it helps me make the decisions. Not to mention, it's a great, unfortunately I found, uh, tumors and different things, cracked vertebra that you wouldn't want me to adjust you.
Right.
And it's really a great thing to make sure that you're a good fit for a chiropractic adjustment, you know.
Right.
Um, yeah, I don't know if I could work without it now because it's just so part of our evaluation and really kind of checking people out.
Yeah, you can't possibly know that there's a fracture or something just by using your hands.
No,
So,
I
so
don't
that's
have
one
a
of the
crystal
things.
ball.
Right. That's one of
So
the
I got
things
to
that
see what's
kind
going
of
on.
scares people off. But what are there some common myths that people have about chiropractors?
Well, especially, I'll just say one about a myth about X-ray. These new digital X-ray that I have, it's all computerized, so it takes the least amount of radiation to take pictures. So
Hmm.
it's really high frequency, low dose, and we get more radiation flying in an airplane, like to Florida and back, than we do from a few pictures that I take. So that's one of the, a common myth. Another is like when you go to a chiropractor, you always have to go. And that's not necessarily true because we have a care plan and it definitely has an end to it. You get to choose how much you want to use our services. But what happens is people start to feel and function so much better. They don't want to stop that. Like you were saying about, you keep doing maintenance. Not only that, you're maintaining what happened, but also you're preventing things and you
Right.
don't get sick. If you stop getting sick and it prevented that, coming in every 3 to 4 weeks is what a great insurance policy.
Right. Well, and speaking of insurance, insurance covers chiropractic care now. It's not so woo-woo anymore. I mean, my insurance covers it.
Yeah, pretty much all insurances cover, some to unlimited visits, and usually it's just a copay. But if not, if it's out of pocket, we do care plans and give you a discount off of it to, help people fit it into people's budget.
Yeah. Now I know the laser, is that still not covered?
Yeah, unfortunately, it isn't. There's a bunch of research out there showing that the validity of it and the science behind it and how it works. But sometimes insurance hasn't caught up yet.
That's right. I
So,
know. I know they
so
don't always catch up on.
insurance, yeah, unfortunately, you do have to charge for that. But I try to keep it, a minimal fee of $30 for 5 minutes. But I know another laser center not too far from here charges like almost 2.5 times that for the same amount of time. So we try to keep it, something affordable so people can use it.
Right. And in conjunction with their adjustments as well.
Yep. And sometimes people are going to another chiropractor like you, and they just want to do laser. So we also have, amounts that if you're just doing the laser only, it's a little bit more expensive, but it's still very affordable.
Right. Well, that's great. Well, I don't have much more time because time flies
Wow.
with having fun, right?
Yeah.
I
I can
know.
talk to you forever.
I know. So I just want to thank you very much for being on my show. I really appreciate you coming on.
Well, thank you very much for having me. I surely appreciate it, and keep going. I love your channel, getting healthy
All
with
right.
knowledge. That's awesome.
Right. And if you want to find out more about Dr. Todd and his practice, that's stowfamilychiropractic.com, and I'll have that in the credits as well. So thanks
Wonderful.
for joining me today, and I'll see you next time on Get Healthy with Holly.